Just like women don't like talking about their orgasms to the doctor, so does the male patient doesn't like talking about low testosterone to their female doctors. And we need to stop that. Okay? So, I'm Dr. O. I am here at Angelic Wellness. Welcome back to the channel. What we're going to be talking about today is low testosterone, how to fix it. We already talked about in other videos on how to find out if it's low, right? Simple blood test, finger prick, maybe, or saliva test. There are definitely a lot of different ways to check testosterone level. But once we now know that it's low, what do we need to do about it? Okay, so I'm going to be talking about that today. I also want to mention in this video about what symptoms actually let you know that you might be experiencing low testosterone and you need to talk to your doctor about it. Male or female doctor doesn't matter, guys. You need to let the doctor know what symptoms you have. So I'm going to address this one myth, okay? This one myth that actually holds male patients back from discussing this with their doctors. And it's this idea that if my testosterone is low, then I'm not man enough, right? And we need to get that out. That is a misconception, okay? It has nothing to do with your sexual ability. We're talking about if testosterone is low, we are actually more concerned about your heart and your brain, because those two things will not function right. Okay, so let's focus on the right stuff. Yes, for some people, libido is affected, but actually it's not the majority. You guys will be surprised how many times I have female patients call me after they find out that when I check their husband's testosterone level that it's low, and they're calling me to beg me not to give them any testosterone. Because they're thinking, oh my God, he's gonna want more sex and I'm not ready to give him any more. So when you give him testosterone, that means automatically that he's gonna want more sex. And that's not what we're talking about, right, at all. The importance of testosterone in both men and women is so important that regardless of sexual function, we need to improve testosterone level, because we've talked about how important this chemical messenger is to brain function, to energy level, to building muscle, recovering from exercise, keeping body fat down, keeping belly fat down, and also, yes, it can help with libido in some instances, okay? So when I get a call like that, when a female patient calls me and says, hey, Dr. O, don't give my husband any testosterone because he already wants a lot of sex and I don't want to give him any. I have to educate them that that's exactly the reason why it shouldn't be the focus for men to worry about the libido part of things as the only thing. Because even more important than that is that testosterone is protective to your heart. If you don't have enough testosterone, you're at risk. More risk for heart disease, and if your testosterone is too high, you're also at high risk for heart disease. So we have to get it right, okay? So we don't just inject testosterone thinking we're going to get more sexual function out of it. We are injecting testosterone only for patients that will benefit from it because their level is low, okay? So let's talk about how do we check it, how do we replace it, all that, okay? So the first thing is, are you having symptoms, right? If you are a male that is finding that you are having a harder time with energy, right? You just get home from work and all you want to do is just go slouch on the couch and watch TV rather than put the gym clothes on and hit the gym. Or you're finding that like you're starting projects, you can't finish them, you have no motivation to go finish that project you started that's sitting in the garage. Or you find that your belly fat just keeps growing. You're eating clean, you're watching what you're eating, but it seems like this belly fat just won't go away. and you know you're not drinking excessive alcohol, right? You're not eating too much sugar. Those are other things that can make your belly fat grow, right? But you're doing all the right things, but your belly fat won't come down or it just won't budge. You also find that when you do go exercise, you're not recovering. Like your energy level after exercise, it takes like 2-3 days before you feel motivated again to go to the gym because you're still hurting. There's aches and pains and soreness in all your muscle. Well, that's a sign that testosterone is getting lower or maybe not optimal. It doesn't necessarily mean it's low, it just means that, well, for where you are right now, it's not optimal for that age, okay? So those are the things that we are seeing sign-wise that makes us go, maybe I should tell my doctor about this, let them draw some blood tests, check and see where I'm at, okay? So when we get the numbers back, then we can decide, okay, let's do something or at least maybe make some changes to help optimize the levels. So again, the point I'm trying to make here is that don't automatically assume that because you're asking about checking your testosterone level that the doctor is thinking that you're having sexual dysfunction. Okay, because they're not the same. In fact, a lot of patients find out that after they replace their testosterone, they still have erectile dysfunction. Okay, so there are two different problems, and we don't want to keep mixing them or assuming that they are the same, because I see that a lot. And both the spouse, female spouse and the male spouse, both of them are thinking that it all has to do with the testosterone only. I'm going to touch briefly on erectile dysfunction here, but I want to dedicate a separate video to that because erectile dysfunction is actually a more systemic problem that tells me there's something wrong with the plumbing system, right? It's not just testosterone level. So what do I mean by that? A lot of times what we find in patients that have erectile dysfunction is that they actually have underlying metabolic problems that is affecting the way their blood vessels function. And they are at higher risk of heart disease, strokes, and major health problems. And erectile dysfunction might be the last thing on the list if we don't address those underlying issues, okay? So yes, can testosterone help? If it's playing a role in that, yes. But it is not the main thing. And I really hope that at the end of this video, you are getting this right. If you have symptoms of low testosterone, like I've listed earlier, right? The fatigue, the taking too long to recover from exercise, not feeling motivated, finding that you're just tired all the time, right? You're growing belly fat. Those symptoms, you're having that. You need to go have your testosterone level checked, okay? And the solution to treating your testosterone is not always just inject testosterone, because there's a lot of that going on. There's a lot of clinics that are just injecting men with testosterone, and whether they need it or not, whether, you know, because a friend in the gym is looking more buff and now I want to get more testosterone. It's not about that. We're talking about optimizing your level if it's not optimal. Or if it's low, we definitely have to do something about it, right? But it's not just about libido. In fact, I've had several patients where their libido was not affected at all and their testosterone was shockingly low, okay? So we want to separate that link where most men, the minute they hear testosterone, they think of libido. No, you hear testosterone, you should be thinking heart disease, stroke, if I don't fix this, okay? That's what I should be thinking about, right? Energy, we should be thinking energy, my sleep, my brain function. We should be thinking my belly fat, right? We should be thinking more metabolic issues that are very, 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 very crucial and important, and not just testosterone libido, because it doesn't always equate. And I see that clinically every day in my clinic. Okay, so I just hope that this video drives that home that, man, please ask. If you're having any of the symptoms that I've mentioned in this video, ask your doctor to check your level. If you want to hear more, join my free VIP group. You will see the link below this video. Click that, join, because we can go way into more depth. All right, see you there.